Aloha mai kako, and welcome to this session of Brown Bag Biography, the longest running seminar series at the University of Hawaii at Manoa. Today's talk is actually talk number 768. It's been running from the mid-1980s and was the idea of the Director Emeritus, George Simpson, and is very ably organized by Paige Rasmussen, the managing editor of Biography and Interdisciplinary Quarterly, and Zoe Sprout, who's the graduate assistant at the Center for Biographical Research and has done all the advertising and is ably managing this particular presentation. Before I introduce our speakers today, there's a couple of things I'd like to do. And I'm initially going to start because the next session is tied to this as well too, is to talk about briefly the appearance of the book that is in some ways part of what we're going to be talking about today. And that book is, and the contributors haven't even seen this yet, but the book now exists, all right? It has existed for a few months, and I'm going to talk about that in just a second. But the hard copy are actually in now, the paperback and the hardcover. And this is The Value of Hawaii 3, Hulihia, The Turning. This is a collection of essays by 65 to 70 contributors, brief essays, roughly about 1,500 words, and in which each of them addresses our situation of turmoil, change, and what kind of a future we're going to shape out of the convulsions we've dealt with in terms of the past and the present. It's a very impressive group of people. And I'd also like to mention that the book, which is co-edited by Nohalani Goodyear Kūpuna, myself, Jonathan Keikomakuvivo Ole Osorio, and Aiko Yamashiro, is available from UH Press. It can be ordered for the paperback is $24.95. The hardcover is $70. But what is most important, and you will see this in the chat, is that the book is available free through public access, the individual articles, and downloading the entire book, because we want this to be available to be able to start, continue, and suggest discussions for everyone. And for any educators are there, it is there and available to be loaded down for free to start or continue discussions. And if you look over in the chat area, Zoe or Paige has actually put that up so you can actually download the entire book while you're watching this, and it will always be available at that particular site. So the idea is that this is there to be able to be a common source of conversation and information and inspiration, in keeping with the tradition of the Value of Hawaii series. This is number 3. And in each case, there was always a sense of a need or a value in having the book come out, but never more so than with this third one. All right. Before I introduce our speakers, I want to mention the Brown Bag Biography series will be running for the entire semester. And the second session is also devoted to contributors to the Value of Hawaii 3, Hulihia, The Turning, which is what it undermines or underpins the presentation we're going to get today. There's going to be a large number of events. You'll be able to connect in and find out about those, all tied in with discussions with the contributors and whatever on the ideas presented in the book. But for the Center for Biographical Research, what we decided we would do in terms of featuring events was actually focus in on and invite people whose essays, and we asked everybody to do this, to speak from where they stand, to talk about their own personal relation to the issues or the expertise that they work within. And when we were putting together the series of Brown Bag biographies for this semester, what we thought about was what essays were the ones that in some ways spoke most personally and yet in an informed and contributing manner to the general discourse. And so as you will see today, the 3 people who are speaking, and you can load down their essays whenever you like, all are inspiring not only because of who they are as individuals, but the degree to which they're integrated within the community in their own areas of expertise. I'd just like to mention that the second of these sessions will be next week. And we will next week be featuring, same time, same place. Next week, the speakers who also have essays in Value of Hawaii 3 will be Paige Miki Kala'okanani Keaweʻaimoku, an MA candidate in Olelo, Hawaii at the Kawaii School of Hawaiian Language at UHM, but also DJ Mermaid. If you listen to NPR or HPR in the evenings, you will often hear her there. And one of the things she's going to be talking about, she is one of the 2 Olelo Hawaii students at the university who have been teaching those free online classes in Olelo Hawaii that are being watched all over the world. She's going to be speaking about that. The second person who's going to be speaking is someone many of you will be familiar with, Kū, who's the founder and executive director of Kua Kanaka. And then another educator, all 3 working in those areas, will be Presley Keala Anuhea Amuksang, better known as the Chancellor of Pu'uhuluhulu University and an instructor at the Kawaii Center for Hawaiian Language, UHM. So these are essays that are informative, they're inspiring, and they're also testimonial to the character and the focus of these speakers. In each case, the personal is political, the person is public, the personal is positive. So we hope to be able to join you next week, and they will have put up in the chat also the entire schedule for the semester, and I think you'll find many people who will be very interesting down the road. Okay. A couple of things just about the format here. Because of issues for security matters and various other things, each of the people will be speaking. If you have questions, if you could put those in the chat, and I will convey those over to the people after they've each spoken. They're each planning on speaking for, maybe 10, 12 minutes about their particular essay or whatever they want to be talking about. And in particular, we hope addressing the notion of how they brought themselves to writing about the subject that we asked them to write about. I think we're therefore ready to go. What I'm going to do is going to introduce all 3 and then just let one voice follow the other. Okay. Our first speaker is Joseph Keaweʻaimoku Kaholokula, who is professor and chair of Native Hawaiian Health at the John A. Burns School of Medicine, University of Hawaii at Mānoa. His essay is COVID, the disease that has shined a light on health equity. And what we'll see here is a remarkable combination of medical expertise, institutional responsibility, and a strong commitment to the notion of the social and cultural factors that tie into something like the kind of medical challenge we're facing at this time. Our second speaker will be Shelley Muneoka. She is a Kanaka Maoli woman born and raised in Heiaʻuli in Koʻolaupoko, Oahu. Shelley works at Kūpuna, the National Resource Center for Native Hawaiian Elders, and continues to share meals and mo'olelo with her grandma. Her essay is called Wednesdays with Grandma. I just also like to mention that Shelley also, in some ways, stands on the shoulders of giants, because when you talk about her Kūpuna, these actually include Joseph Moku Ohai Poi Poi. So she comes from a long tradition of profoundly contributing Kūpuna within Hawaii. Then Kealoha Fox is a Native Hawaiian scientist, traditional practitioner, and advocate who practices a social determinants of health model of care at AlohaCare, a nonprofit health plan in Hawaii. Ulukokui o Kaolike was awarded the Snapshot of Innovation to Build a Culture of Health Award by the Robert Wood Johnson Foundation in March of 2020. She is also the Asia Pacific leader for the Obama Foundation. And her essay is on Ulukokui o Kaolike, Advancing Justice for Kanaka Maoli in One Generation Through Health Policy. I am very much looking forward to hearing these people speak because I enjoyed so much working with the essays that they wrote. And I hope you will read them after you hear them. So, Keawe.
Mahalo, Craig. Aloha, Felina Mekila Yakako. Mahalo for that introduction. First of all, mahalo to the editors for this wonderful, awesome book. Craig, John, Aiko, Noi. Also like to aloha Shelley and Kealoha, sharing the stage once again with them. It seems like missing a lot of them over Zoom. And as you mentioned, Craig, my essay was really personal, professional, and everything rolled into one, things that I've been working on for years. And COVID-19, the disease that has shined a light on health equity, is kind of, I guess, an ironic title. And I'll explain a little bit what I mean by that. The disease, COVID-19, has really, shed a light through the cracks of our political, economic, healthcare systems. And the inequities we are seeing in COVID-19, meaning the undue burden on communities of color we're seeing across the US, but here in Hawaii, the higher burden of COVID-19, our Native Hawaiian, Pacific Islander, and Filipino communities were totally avoidable. And they really have to do with the underlying social determinants of health, factors that have never been adequately addressed, although, something we've been talking about for years. And the social determinants of health are really the economic, political, and social factors that really affect the lives of people and therefore their risk or their health status. And, and COVID-19 came along, and all of a sudden, the things I've been talking about for the last 20 years is taken more seriously. And it's unfortunate that we had to get a pandemic for this dialogue to happen, both on a national level and on a local level here in Hawaii, in which we have to, going forward, to prevent what we're seeing now in our communities, again, the burden, unnecessary economic, medical, social burdens and cultural burdens we're seeing on communities of color, is to avoid that in the future, because there will be other pandemics, unfortunately, and probably shorter in distance and time than we would like. And it really spoke to that. And prior to COVID-19, I think people understood it. It was something that now is promoted nationally, social determinants of health. In fact, Kealoha, when she was at the Office of Hawaiian Affairs, helped to put legislation together to really make sure that every bill, every law that's passed accounts for the health of our communities, especially Native Hawaiians, and really focus on social determinants of health. But I always felt like I was, swimming upstream. I think people appreciated that these other factors were contributing to our health and well-being, but often people thought they were either too large or not within the realm of control. And often public health and medical profession targeted genetics, biology, and people's individual behaviors as the reasons for these inequities that we see in people's health and health outcomes. And I was really trying to get attention onto the social determinants. And again, along comes COVID-19 to help me with that. And now everybody's talking about it. Now we know better what it really means to have poor social determinants of health that affects our well-being. But, I won't take up too much time because I know we have the other three speakers. But I recommend several things that I think going forward that we need to pay attention to. Our policymakers, our healthcare administrators, our medical profession, our researchers really need to pay better attention to. And they're around a couple of issues. We know that one of the big social determinants of health factors is education, because a good education leads to a better income. A better income leads to a better quality of life, and better quality of life leads to a longer life expectancy, as well as a better quality of life overall. But unfortunately, here in Hawaii, we don't have quite the our public school, for example. Our public school system is not as strong as we would like it. And despite having Kamehameha schools, an excellent school, most of our Native Hawaiians, Pacific Islanders, and Filipinos are educated by our public school systems and great teachers, great people there, but they're under-resourced and underappreciated by our policymakers. So they don't quite have the ability to really provide the kind of education that we need. And there should be no difference between public school and a private school education. Really, it's one of those institutional racism issues that puts people of color at a disadvantage and continues to perpetuate that. We need to address that. We need to change that. And we know from research, again, that a good education leads to better health outcomes. And we also need a good, strong university system. Right now, going forward, our university system is threatened by budget cuts and other things. But studies, again, show that a strong university system in a community, actually the quality of life and life expectancy, to include Hawaii, there's data on Hawaii, that shows that we have better outcomes when there's investments made by both government and our university institutions are involved in our community, solving our community's issues. The other things that we need to do is we need to provide livable wages. We have the highest cost of living. Native Hawaiians, when I first started graduate school, the number of Native Hawaiians was roughly 27% in the state. Several years back, it was 25%. Then it went down to 22. Now it's at 21%. Our people are leaving. Our indigenous, our host culture, our people are leaving the state because they can't afford to live here. They have no place. We have to change that. We have to, in part, increase minimum wage. And I'm glad to hear that the new president of the United States is looking to do that. And in states that have done it, have shown that the more you pay people, the more they spend, so the economy gets stronger. But studies in the health sciences actually show that the more people make, even if it's just $1 increase in their hourly wage, does decrease their risk for a number of health problems, especially among poor women when it comes to adverse childbirth outcomes. So we need to do something better around that. We need to create jobs here in Hawaii. We need to diversify and localize our economic base. And again, research shows the more people earn, the longer we live. We need to ensure there's innovation. That's why the university is so important here. We need to uplift our local businesses, entrepreneurship. We need to increase opportunities for our young people to stay here at home and make a living and raise their families. We need to make Hawaii affordable. Kama'aina, again, as I mentioned, people are leaving. We need to invest in those neighborhoods and communities where health promotion makes the most sense. We need to start investing in our communities, our Native Hawaiian communities, our homestead communities, our low-income communities, because that is where health promotion should occur. Not in a hospital, not in the four walls, in the 15 minutes you see a physician. That's disease management. That's not disease prevention. We need to turn our attention to disease prevention and put it in the hands of the people that know how to do that best, who knows what needs to happen in their communities and the best strategies to do that. And again, we have data to support that. These are evidence-driven approaches that can be applied. We need to ensure equitable access to educational, financial, occupational opportunities, regardless of ethnicity and social circumstances. Again, we need to tear down the walls of discrimination, of institutional racism. I'm a researcher who researched the effects of racism on health, and it is affecting our people, and it is prevalent. Despite what people think, the Hawaii being a melting pot, there is a lot of discrimination, both explicit and implicit. And finally, we need to uplift our Native Hawaiian cultural values and perspectives to preserve our cultural and natural resources. We got to change the value system in which we make policies and in which we allocate resources. We have to, I always tell people we can either operate on a value system that is 7,000 miles away on the East Coast of a continent that does not really resonate with us, among who comes from white backgrounds, white Protestant male backgrounds, or we can use our own indigenous values and perspectives here at home, because it's what everyone wants, right? It keep our families here, sustainability, being able to live and afford to be here in Hawaii. So those are the things, I've really been trying to promote. And I think going forward with COVID-19 recovery, there's an opportunity for all of us to really make these things happen. Mahalo nui.
Thanks so much, Keawe. Aloha kako. I'm Shelley. I have to aloha Keawe. He's actually on our advisory board for Kūpuna, which is where I work at the University of Hawaii at the School of Social Work, and also Kealoha Fox, who's a good friend and colleague of the center. Super stoked to be on this panel with you folks today. Just to tie in a little bit to what Keawe was talking about, he talked about the need to pay a living wage, the cost of living, and this mass exodus of people, local people, Hawaiian people needing to leave Hawaii because of economics. And when I think about the value of Hawaii, it's not only an exodus of people, but it's an exodus of values. And when I think about what COVID-19 has, when I think about values and we think about quality of life and things like that and economics, to me, one thing in terms of like personal life and kind of daily living, it changes the way that we experience time, what we do with our time. And a lot of what I talk about in my essay is about spaciousness. in quality time. So until we address the high cost of living here, we won't be able to have that spaciousness that I think is necessary for a good quality of life. So the essay that I wrote is called Wednesdays with Grandma. And it's about the last few years of getting to know my maternal grandmother more well through weekly visits, just to do simple things, grocery shopping, go doctor, bank. She lives alone. She is legally blind, so she can't drive anymore. She just turned 88 this week. And time with her has been completely transformative, I think, for her life and my life, and I think for our family. Also in the essay, I talk a little bit that my mom died when I was 11, and this is my mom's mom. So being able to spend time with her and kind of reconnecting intergenerationally, I think is going to be important for our family in the long run. But because that's in writing and you can access it for free, today I actually wanted to talk a little bit about my other grandma, my paternal grandmother. Today is her birthday. She would have been 89. And 2 years ago today, I delivered her eulogy in a small Catholic church in Waikane called Our Lady of Mount Carmel. And it was her birthday, her wedding anniversary, and her funeral, all on the same day. And it was the most important thing I've ever written. And today's theme about the power of the personal had me reflecting on that experience. So for our essays, I'll tell you guys, there was a strict Craig-enforced word count on the essays. And so I wasn't able to actually tell the story of my other grandparents who really induced the situation that allowed me to have Wednesdays with my other grandma. So it started one early morning with a dream or a vision of sorts. I was working at Mānoa in Lualualei, and I was living with my family in Heiʻeia. So the commute every day was an hour each way. And it required me to get up at 4:30 in the morning to get to work by 6:45. So my other grandparents, my paternal grandparents, they live in Kaholokula, and my grandma was a lei maker, and my grandpa was her flower picker. So every day he was up before the sun, and he would tie a bucket to his neck so he could have two hands to pick with, and he would take his homemade hook he made out of a broken fishing pole on a hanger to pull the branches to him, and his other hand he could pick with. And my grandma always told us, that the sun makes the pu'keni soft, so you have to pick it when it's still dark. So one morning I'm laying in bed, my eyes are still closed, I have to get up to go to work, and I had this vision of my grandpa picking flowers, like he always did. And it was so hard for me to drive to work that day, because I just wanted to turn my car 10 minutes to Kahaluu to go pick flowers and make lei with them. But instead, I had to drive an hour away to go to work. And I actually ended up quitting my job that week. My grandma had been diagnosed with Alzheimer's just a few years before that. And that morning, I had so much clarity about the passage of time, and that I didn't have time to be with them. And I knew that one day she might not be able to recognize who I was. And I wanted to spend time with her and hope that that familiarity and time together, even if she didn't know how we were related, that she would know that I was a friend, not a foe, and that she would feel comforted at me being around. So I quit my job and I go over and I tell my grandpa I'm all excited, and he was so upset with me. So upset with me. He was like, "Who told you to do that? I didn't ask you to do that." And I should have asked probably first, but I'm actually glad I didn't. But he wasn't ready to have an interloper in their daily routine. He wasn't ready to have me be around in the way that I wanted to be around. And even now, he's 93, he's deaf and blind, and he's still fiercely independent. But anyway, because he wasn't quite ready to have me around, I suddenly had a very clear schedule. And that was actually the context for which I started spending time with my maternal grandma, who this essay is about. And I actually don't talk about my Kahaluu grandparents that often in public. I often share about my grandma, who the essay is about, like on social media. And when I had realized that difference, I had to really reflect on why. And I thought, okay, is it maybe because I'm embarrassed about her Alzheimer's diagnosis? Or do I feel shame that they live very humbly, still no more paved road, no street light, you know, they still live very humbly in Kaholokula. But when I thought about it, I said, no, that doesn't really resonate as true for me. And so when I really thought about it, I think it's because I feel so protective of her and of those stories and of our time together. And so reflecting on this idea of the power of the personal, I really think that's where we can feel that power the most, in those most personal, most formative, most consequential relationships and experiences. And so I'm so grateful to the Value of Hawaiʻi for giving me a chance to kind of reflect on that. My day job, as we mentioned, is at Kūpuna, which is the National Resource Center on Native Hawaiian Elders, and which is why I think I was asked to write about elder care. And my relationship with my grandparents, all of my grandparents, very much informs my work there. But I always felt, you know, that I should keep some separation between the two. And this essay was a chance for me to bring them into my job. And it really helped me reflect on the way that all of my grandparents are my research partners, I say, because we do both quantitative and qualitative research, which means focus groups and interviews and, you know, hearing people's life stories, as well as looking at large population studies and drilling down to kind of trends at a societal level. And, you know, themes emerge and theories emerge, and taking those and applying them to real people who I know deeply, their histories, their orientations, and seeing the way that those fit or don't fit has been a really important tool for me, particularly when forming like research or interview questions, to remember what is this maybe not capturing. So anyway, I've like no concept of time, so I don't know how long I've been talking, but I feel like I should maybe turn it over to Kealoha soon. To prepare for this talk, I went and read all of, you know, Keawe's essay and Kealoha's essay. And Kealoha's essay talks about kukui, a grove of kukui trees. And so in closing, I just wanted to share this olelo no eao that I love called Aea, or that goes Aea e mohala i luna o ke kuku, i luna o ke kukui, which talks about a kukui tree turning white with flowers. And it's a kind way, a poetic way to describe aging, getting older as our hair gets streaked with gray. And my friend told me, yeah, and you think about it, pua are, you know, children, grandchildren, and can think about the ways that they might help your hair turn gray, which kind of gave me a chuckle. But anyway, with that, I'm going to turn it over to Kealoha, so we can hopefully get more to a discussive point together. Aloha.
Aloha no, Shelley, and sending aloha especially to your tutu today and this day of memory and recognition of her. Aloha Keawe and all of our friends at the Center for Biographical Research across the UH system, and for everyone else joining us. I am zooming to you here in Hawaiʻi at the base of the AlohaCare Ridge. In between Hulihia and Mauna Kapu. I'm especially excited to be among the leaders that were invited to submit pieces in the Value of Hawaiʻi 3, and among, you know, friends and change makers here all around. I truly believe this publication is the most important publication to come out of Hawaiʻi in 2020. And I think for generations to come, we'll look at this as a time capsule that captures, I think, more than 65 contributors in various sectors. The three of us work deeply in health, in medicine and healing, but also across education and economics and land back and civil rights, and just so many ways that our Hawaiʻi is continues to flourish despite all of these barriers that come against us. And so that's really where I started with this piece is I thought firstly about my Kūpuna also, of where I was at the same time exactly 1 year ago. I was asked and invited to submit a pitch to really high level health equity and racial justice leaders in the South. I had been working in Georgia and Alabama for various projects and with various organizations, and was invited to Jackson, Mississippi to present this pitch of what was my vision of advancing health policy through an equity lens. And so Ulukukui o Kaulike is really this vision statement that it incorporates a vision, a long-term vision to look beyond 2030, that looks beyond, to 150 years from now. But it's a call to action and a possibility to eliminate health disparities within one generation by 2030. And there's some key strategies that I've included and lessons learned of how we can integrate Native Hawaiian values of Moliola towards these priorities and through policy mechanisms to strengthen our population and actually all of Hawaii. And so like we plant our trees, and like these trees grow and they sprout these flowers, and they grow these nuts that provide medicinal value to us. We can also plant systems change through really creative and culturally informed policy mechanisms. And that's a lot of what my work was for 10 years, working in the government, and was able to see how that happens in real time. And so I really look at this concept and this metaphor of the growth of the kukui as a representative growth for how racial justice can continue to grow and sprout for Kanaka Maoli, that returns healing into our homes across generations, back to connect us with the land again, and the land that we grow from, just like these seeds do. And so what the vision statement really calls for is where I hope, just like we could ignite a torch with the kukui oil, that we ignite systems change through flames of equity, so that it's actually the kukui that light our way, and it's the values of this place that guides the direction forward, rather than individual power or politics that typically get in the way of effective policy solutions. And so it really ends with this olelo no eao as well, of ka'ipu kukui pio ole, that we are the light of justice that won't be extinguished. And by each one of us holding that flame and keeping that flame within us, our own survival, our own resilience, if you may, is a part of that inability to be extinguished. And so I'm so grateful that I've been welcomed into the civil rights Black community in the South, to be able to understand this from their perspective and to share, because it also allowed me to tap into the genealogy and the legacy of my grandmother, who grew up in the South. I don't talk about her in this piece, but she did grow up in the South in abject poverty, and grew up picking plantation cotton. And so I think about the same values that Shelley was mentioning in her piece, and I find so much resonance in mine, and the light that came through me, I feel like is also coming through her. And so I believe fundamentally it's not actually, it's not just about us as individuals. I believe that those kukui are actually, the representatives of all of our ancestors, lighting us and turning us on, so that we come together for collective action today. I too hope we can get into, the dialogue and some of the, questions from the group, but I just wanted to, share that I think most importantly, the idea for this piece, the idea for this pitch was born from the place of my other grandmother, my tutu wahine from Maui. And I fundamentally believe that all of my, the greatest project ideas and greatest policy solutions have always come when I am quiet and sitting upon our land. And so I think that that more than anything is, you know, the biggest change that we need to think about before 2030, and how do we protect this place so that people like us can continue to sit there, and that in 150 years from now, that our descendants will sit there and they'll reflect upon us, and they'll have this book to help to guide them should they ever find themselves in subsequent generations looking for inspiration or need a way to light their pathway forward despite any obstacles, be it pandemic or economic collapse, or other disparities that hit their way. So I'll just close there so that we can start the group Kuka Kuka. Mahalo, everyone, and I really do hope you're able to read all of the pieces and share them generously through the open access that has been gifted to us through the University of Hawaii Press and the editors who have helped to ensure that for everyone to access these pieces. Mahalo.
Okay. Oh, mahalo to all three of you. We've got one question that already came in, so we'll start there. And if other people have questions they would like to ask or offer opinions, if you could do that in the chat, and we will transfer those over, and they can be answered individually, or we can have all three of the speakers sort of taking turns or talking simultaneously about it. All right. The question that came up was from Jeff Yamuchi, and he was asking Keawe specifically, what's your take on vaccine distribution, especially with prisoners? Because this is in some ways the second shoe in your essay, that notion of basically, to describe it in some ways, it's a description of Keawe banging his head against the wall for 20 years, saying the same things over and over again, and having people sort of listen and then walk away. And now suddenly people are listening to the banging, but it has to do with this. And COVID is in some ways the inciting concern. So could you give us sort of an update and where you are in relation to that? Oh. You're muted. Yeah. Okay.
I'm sorry, Craig. To Jeff's vaccination question, you mean? I'm sorry.
Yeah.
Okay. Well, I responded to Jeff earlier, but you know, I really think it's important for us to prioritize the most vulnerable among us, right, for these vaccinations. One could argue that the incarcerated are kind of a closed community, but there also could be super spreaders, right? And they can also spread it to our guards and other administrators there that they are close quarters with. But they're also part of our Native Hawaiian Pacific Islander communities. And I do think we need to prioritize, especially our Pacific Islander and Filipino communities that got hit the hardest. If people are not aware, I believe it's 16 of 21 states that do report disaggregated data on Native Hawaiian Pacific Islanders show that we have the highest cases of COVID-19 than any other ethnic group. And among those that report death rates, disaggregated data show that we have the highest death rates, higher than African Americans, higher than American Indians and Hispanics. So we should be prioritizing these communities. We should be organizing, in my opinion, pods and people to go out into the homestead communities, into our low-income communities, housing, and create and go to where the people are to vaccinate. They need to be prioritized. They're as much vulnerable as our Kūpuna. Because they are essential workers. They live in multi-generational households and dense communities in which if someone gets it, they're going to spread it pretty fast. And this is not because they want to or because they're at risk biologically. It's simply because of economic circumstances that are really underlying all these issues. So I'm sorry, that's a long answer to the question.
Okay. And I just follow up by mentioning Kealoha was talking about the number of essays. There are actually 2 essays in the Value of Hawaii 3, which are specifically about the current state of prisons and actually addresses those issues about issues of health and sustainability. While we're waiting for I'd like to just pose a question, which is in some ways tied to the theme that we've been talking about here. It's been referred to a certain degree, but for all 3 of you, because you work and are constantly in contact with sort of large institutional, governmental, business authorities that you often have to navigate with, I was just wondering, to what degree do you ground your responses or find it useful to be reflecting on your sort of own personal circumstances? What do you bring individually to, in some ways, have to deal frequently with what seems like a monolith, and what works and what doesn't tend to?
Ladies first.
I'm just sitting here thinking about that question. I mean, I think it's a personal choice, and I feel like you have to do some mental math over the safety of the space that you're sharing that into. I think part of the understanding is because we know that these stories are powerful and our experiences are powerful. And so, like I was saying, like I feel so kind of protective about them. So I don't know, my personal practice is more to maybe reflect about the actual, personal experiences and extrapolate things that feel safer to share in what might be an adversarial situation. And, I mean, it's very situation based, but if able to connect to the person that, you're trying to have a hard conversation with, I find that if you can get to a personal conversation with them as well, that it's, you have to build a strong relationship so that you can sit in the discomfort of disagreement, and where it feels safe to be vulnerable and genuine with other people. And it's hard to do that in a big institution, certainly. So I don't know, you kind of gotta use your judgment in terms of your energy. Yeah, I don't know.
Yeah, I agree. I mean, I think judgment and discernment is so critical. I think especially for young professionals who identify as Indigenous women, like Shelley and myself, there are many spaces that are unsafe for us to share openly. And that's just the reality of where the spectrum of justice continues to need much more growth and equity in reality. I work in the industry of healthcare now. I don't know if we're live streaming this. I know we're recording this, but so because I don't know if we're being live streamed, I will say that in general, the healthcare industry has been really slow to adopt changes and innovations that support all people. And that when you try to increase culture, language, land-based programs, for example, generally you have a leadership that looks at value through the lens of finance. And value is equated to money, right? And what is the return on investment, or what is the cost savings that a culture or language or land-based program might be able to offer that that company or that organization? That's really the status quo of where we're still at. I am lucky to be in a space now where, through this new work of bringing social health integration into AlohaCare, we're really hoping to change that, and we're hoping to meaningfully collaborate to create programs and services and covered benefits that look like the values of Hawaii and that reflect the values of the people that live here. We don't have corporate interests on the US continent, and we don't have corporate interests that are bought by shareholders. And so I think that there are structural differences between the types of systems that allow for policy changes internally that can ameliorate some of the disparities or can really hinder the progress of an entire industry. And so I think I'll stop there, because like I said, I don't know if we're being live streamed, and so I won't go into too much detail there, but I will say that the healthcare industry in and of itself has a tremendous amount of promise and work that it can do, so long as it's committed to do so for everyone, and that our pathways are equitable to get there, and that we're not thinking about money over people.
And you are being live streamed.
Thanks, Craig.
I guess I won't answer the question then in that case. So I agree with what Kealoha just shared. I'll add, my experience has been this, working with policymakers, working with healthcare administrators, and even academic administrators. There's a lot of competing priorities, agendas at play. Often you have to, work through that. As much as I would like to say we're data driven, because we spend a lot of time collecting data, making reports for policymakers and everyone, it's not often that we actually use this data or these data to make good decisions. And I do find that the personal stories behind the data is powerful. I used to tell people, if you make a policymaker cry when you're doing your testimony, then you got them. And that doesn't happen with data, it doesn't happen with science, but it does happen with personal stories. And I think also happens, at healthcare systems that are also complicated, that when you can, and not just put in your perspective, your personal stories, but it resonates with the people you're trying to convince. We tend as Native Hawaiians to talk from our experiences and expect non-Native Hawaiians to really understand it. But until we put it in their shoes, into their life and what they experience, because everyone experiences at some point bias or discrimination or adversity, that when we can do that effectively, I think we can move things much more quicker than just simply focusing on and simply doing the logical approach, which is often data. But I'll stop there, but thank you.
One thing you just said, Calvin, made me think of something else. One thing that I think is useful sometimes is, I know it's kind of reflecting on what we may share in a kind of professional setting, but thinking about ways that you can ask other people that you work with to share, or somebody that you're like Calvin saying, you're trying to convince them, but ask them questions that get them to think about, personal impacts, to find a way for them to like hook in and connect. It's useful.
Any questions from the people who have joined us here? Just anything that you might, even just a comment, more than welcome. You've awed them. I'll throw another question in here, and I hope we'll get a couple of responses. When we had sort of a virtual hui, an aha hui for all the contributors, or an awful lot of the contributors, and one of the questions that the book asks, and something that I've been sort of upset about as a grandparent, the apparent lack of attention we seem to be paying collectively and in all sorts of other areas to leaving a future beyond when we're here. We were, mentioning, planting trees that you aren't going to be there for, that kind of thing. So one of the questions that we pose in the book is, what will it mean, or how will we be good ancestors? So I was wondering if each of you could just share a little bit. Kealoha has already been talking about 2030 and 150, and that ties very much into those wonderful things in the New Pepper in 1860s and 70s, commenting on about, we got to be thinking about 1990s for people. So could you each just talk a little bit about your notion of not just sort of a vision of Hawaii for future, but what kind of a life would you hope for the people that you're inevitably going to be tied to down the road?
Okay, I'll go first this time. When you ask that question, Craig, I really think about the three people, right? the piko that connects us to the past, the piko that connects us to the future, and the piko that connects us to the present. And, you know, I think you're correct. You know, as Indigenous, as Native Hawaiians, everything we do is about the future, sustainability, having something here that's better than that we have, leaving something better for the future. But I think what's different about us as Kanaka is that we do so mindful of the present and past, and that everything has to connect. There has to be this continuum in time, because this is the only way, long after our physical presence is gone, it's the only connection and the ways to reconnect. And I think as we think about how do we create a legacy for the future, you know, it needs to connect to all three people, all three part of our mo'oku auhau. It's about sustainability of our physical, cultural spaces, but it's also about how do we build something and build upon our mo'oku, our mana, so that it carries forward in a good way and it continues to get built upon. I think that's always the thing, at least I think about. It's not just about me, it's about what came before me and what will come after me, and what am I, you know, as a person, what am I contributing to that ultimately. But yeah, mahalo.
Oh, I'm happy to share from my own research and my own, you know, work in thinking about how the past has really informed my like leadership values in the present in this work. So I think about Hulihia through the framework of my own training in Moliola and our traditional healing practices, and the ways in which our physical bodies hold this eha, this pain, and the turmoil that's been expressed over various generations and decades of Hulihia and Hihia. That connection between us and the spiritual realm, our relationships, connections with the environment. So we know today that some of these ways to express that have been maintained over many generations. They've been passed down intergenerationally. Many of us grow up with the term that we know about of opuhuli, right? So the turning of the stomach during infancy, where the opu has to be lomied and wrapped for the baby to be relieved of this pain, of this ma'i. But when I really looked back in doing my research of what's my own unique, you know, theoretical orientation and vision of what's happening now in 2020 in this Hulihia, I looked at one of our Hawaiian pathological terms of lolohia. And so it's a term that's expressed as a Hawaiian concept of being overtaken by the huli. When we lose ourselves and we're overturned by the negative, you know, we're overthrown into despair. And I think that traditional and ancient concept of lolohia has a lot of lesson and meaning and kona for us today to think about the future for 2030, for, you know, 100 years from now. That if we think about lolohia, there's a real tragic consequence that if we don't act now in 2021, what we hope will be true in 2030 or 100 years from now really may not actually be possible. And so I think as much as, you know, sometimes, you know, those of us that do this work in both worlds, right, we might be criticized that this work is, you know, it's too much, you know, humanities or the arts or social sciences, but that is such a myopic and reductive view of looking at a holistic millennia of systems and ecological based adaptation and survival that our people once thrived under, that I think is very much needed today. And so I'm immediately thinking in my, you know, just like last sentence here, I'm thinking of Ku'ulani Muse's opening poem, A Prayer, a Lifting, where she says, millennia of hands turning soil, moving stones, invoking all forms. And I believe that the turning of the soil and the moving stones and the invoking all forms now, it is a crisis. And I believe that we are looking at this concept upon us now in present day of lolohia that our Kūpuna planted for us years ago, so that they knew that we had a concept that would anchor us into the very real possibility of what the future might bring. And so I believe it is very holistic, and it's very, it's a stark reminder of where we need to go immediately, today and tomorrow and every single day and hour, all of us working together, not just one, but all of us in collective unity. Mahalo.
My answer to this question, I think like my essay is on a much smaller scale. When I think about the question of how to be a good ancestor, what that means for me personally in my life and in my family, it's trying to spend as much time with the older folks in my family and getting those stories that aren't going to be in an archive or in any kind of recorded material, and trying to learn as much about their lives, their values, and what the world was like in their growing up. The image that has kind of come to my mind is sort of like, if you think about subsequent generations or like lives as being like links in a chain, if it's like this, to go from it being these kind of encapsulated experiences that are end to end, and moving it more towards where there's more overlap, so that, so like as an example, if I think about, my grandmother telling me about a certain practice she had when she was young, to not just leave that in the past and be like, oh, cool, archival material, but to actually try and do some of those practices and see what is still possible, what is no longer possible, what has become the barriers, and then be in conversation with her. So, that's why it's important to, why I prioritize the relationships with living Kūpuna today, so that you can ask questions and things like that. So I feel like part of our responsibility in terms of being a good ancestor is strengthening the intergenerational connections to the best of our ability, and to like rebuild that chain of ike that has maybe deteriorated over time because of our economic situations, and we spend so much time apart from each other. So even if we're alive on this earth together, we're not spending that good quality time.
I'd just like to point everybody to the chat section, particularly some of the contributions that Mana Shim is making and the links that are being there, which actually would sort of lead to my next question if I put that together with Jeff Yamauchi. In each case, the issue of prisons, the issue of climate action, and just how Hawaii responsive many of the discussions about climate action are even here. And then the issues of prisons, the issue of climate action, and then also the issue of just overall the military more generally, which is what Jeff's raising. So the question I was going to ask, because that's one of the things that we really wanted in the collection. We really believe that all of the pieces individually are actually talking to each other, no matter how far afield they are, that chain actually does put us in a situation where you can see that overlap that Shelley was talking about. So Keawe had to leave, and we will be finishing in about 12 or 13 minutes. But if Shelley and Kealoha, could you talk about how, for example, the challenges of health or senior care, how are they affected by those kind of global or sort of intrusive? I mean, to what degree does the military factor into the presence of the military factor into your work? Or to what degree do these issues of climate, in some ways, do you consider those? In what ways do they seem to be integrated within the kind of things that you're doing?
Well, I think for Shelley and myself, we're not just doing one thing. Shelley and I think we both operate with an ethos of a pretty wide and expansive kuleana. It also set of passions and gifts that have been bestowed to both of us. And so it's not uncommon for you to see Shelley and I at events or webinars or panels for the University of Hawaii, as much as it is not uncommon for you to see Shelley and I openly, in reverence to Aloha Aina and our patriotism to our homeland and its place and our ability to exercise self-determination, and that those things don't have to be separate for us in our generation, I think is a privilege that perhaps we hold that generations before us maybe weren't as endowed with in the ways that Shelley and I are. And so I think about that too, in terms of privilege of intergenerationality, to be able to even answer this question, right? And I'll just stop there for a second and then let Shelley respond too.
I was just gonna say that the story I told today about like taking time off from full-time work to be with my grandparents, and I was kind of like had this clear theme. Okay, this era of my life is going to be like malamaina Kūpuna, and as I spent time doing that, I realized, of course, Aina is Kūpuna. And part of that time was spent going to deal in our hearings that are happening in the middle of the day that most people who have regular employment are not able to go to. And so that's what I was partly spending my time doing. And it's beyond a metaphor to say that relationship to Aina and relationship to Kūpuna, Kanaka Kūpuna, that those interactions definitely echo and mirror each other. So when you're spending time with Kūpuna humans, and you think about the way you approach, the way you make space, the way you're still, and to just be present, to learn from them, it's very much the same way that I am on Aina, to quiet yourself, and to be in the presence of something that has, maybe doesn't have the same kind of physical vitality, but has strong spiritual, gifts and strengths to share. Maybe like can't communicate with words or with the same, eloquence, but there's so much to learn just by being near to them. So if you take that kind of view, Craig, to your question about like militarism or other kinds of large threats to Hawaii, how does that impact elder care? If you think about elder care as caring for Aina, then, I think you can see that it has everything to do with each other.
And we have a tremendous amount of research, data, and oral histories that show that these major systems throughout Hawaii's history have continued to collapse when we solely rely on really one industry. And so I write about this in Haumea, Transforming the Health of Native Hawaiian Women and Girls, that I published a couple of years ago. And what we found is that you can go really far back to when we talk about over reliance on one industry, from whaling to sandalwood into pineapple and sugar, and then into the military, now tourism. You can see a very real collapse in each bubble over time. And I think we're experiencing that collapse now in terms of the US standard of a public health system. It had been fractured for decades, and it was unsustainable. It's unsustainable by very, very high levels of cost and very, very high levels and increasing levels of need. And that's another industry that's simultaneously collapsing right now. And I think a lot of people have experienced that best in their own families through stories. And I think many people have stories in the work that Shelley and I do, where the healthcare system itself failed their kupuna or their parent or their sibling or their children in a way that it felt like the system didn't have them and their family and their ohana in mind. And so I do think that those systems have a tremendous amount of influence on each and every one of us, from the community level to the family level down to the individual.
Mahalo to both of you, and to Keawe at his next Zoom meeting probably, and also to everybody who's participated and been listening today. I think the discussion made the point that we were hoping it would, which is that there are a lot of things to think about in Hawaii, and that we also have wonderful people who bring their personal experience to doing the kind of work that we need done in all sorts of areas, and especially the last answers, where it's a matter of the kind of skills and the kind of focus that might be there professionally then gets extended out to basically all aspects, is one of the things we were hoping would carry through in Value of Hawaii 3. So again, the posting, and Zoe's been putting those up again. If you want to download the book, it is available for free. If you wanted to have your own physical copy, they are now available. And I would just like to thank both Kealoha and Shelley for their mana'o and their participation today. And I hope we will see many, if not all of you, next week when it moves more into a kind of central area of education. But as we've already been seeing today, no matter what we get started talking about, it's going to go somewhere else. So anyway, thank you all. Aloha.